The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to another Lunch and Learn in our ongoing Financial Friday series. Saney's is excited to offer these sessions in cooperation with our corporate partner, AXA. AXA has a long-standing presence in New York, and a large portion of AXA's New York client base is built upon the work that they do within the public education system. Through AXA, Saney's members can receive competitive insurance rates and a full array of retirement services, including a complimentary financial profile for Saney's members, which we urge you to take advantage of. This is a great benefit. Our AXA presenter today is Greg Pogorski, Advisor and Vice President from the Capital District Office. Before we get started, please note that participants are muted during this session, but we will have some question and answer time following the presentation. If you have a question, just type it within your control panel. We're also recording the session, and it will soon be available at saneys.org, and I'll email all registrants with the recording link as well. With that, I'll turn the presentation over to Greg.
Thank you, Annika, and thank you everybody for joining across the state. It's beautiful here in Clifton Park today, so hopefully it's beautiful across all of your individual locations. Hopefully everyone's got some fun outdoor activities planned this weekend. So today we're talking about a few different topics, which in an effort to not take up too much time, we're doing this in about 30 minutes, but realistically we could probably talk about these three topics for the rest of the day. There's a lot of information to take into consideration when we're looking at retirement expectations and what the lifestyle needs and what the future holds for us. And realistically, between Social Security, Medicare, and long-term care planning, there's a lot of different nuances and a lot of details to be aware of in looking at how these different things are going to ultimately impact your retirement. So again, in an effort to condense some of this information, really what we do with our clients is helping make sure that these individual decisions that are made over time are in line with what those retirement lifestyle needs are, what the retirement income expectations are, and everything there. So again, there's a lot of moving parts to this, but ultimately we're here to help decipher and break down some of those individual discussions into to impactful financial decisions. So ultimately, when we look at the main factors to consider in retirement, there are unfortunately some things that are completely outside of our control, but also some things that we have some control over or total control over. So in looking at a few of these different pieces here, the things that we have total control over from a retirement planning standpoint are our savings and spending habits, right? We do have the ability to determine how much we can save, how much we should be spending. And again, those different pieces there should have a relationship with each other that leads to a surplus of retirement income over time and on a monthly basis. The other thing we have complete control over is really our asset allocation and how we're positioned to deal with some of the potential volatility of the stock market. As we get closer to retirement, we want to start reducing the level of risk that we're taking, but ultimately we still need these accounts to grow over time. And again, that's something where we can control how we're positioned and how much risk we're taking and comfortable taking. The things that we have some degree of control over are how long we're working and the earnings of those working years. And again, not full control over that, but there is a degree of control. In addition to that, we have some control over our longevity, right? And our longevity and our lifestyle choices, the way that we eat, the way that we exercise, the way we take care of our bodies, right? Things like that all lead to hopefully a longer life. The things that unfortunately we have zero control over are things that are things like what's going to happen with inflation, what's going to happen with Social Security, what happens with Medicare, what happens with stock market returns, right? Unfortunately, we don't have those answers today, so we only have a little control over some of these pieces, but unfortunately over some of those things, we have zero control over that. So from a retirement planning standpoint, we want to help our clients and all of our Saney's members take control over the things that we do have control over while trying to mitigate any risks out there for some of those things that are outside of our control. All right, so this is a theme that we'll kind of keep coming back to in talking about some of these different topics today. So ultimately, expenses in retirement, some expenses decrease and some increase. The things that are likely to decrease for a lot of our savings members are things like mortgages and housing liabilities. Mortgages may be paid off before retirement or early into retirement. It's not common to see a lot of clients that are carrying a mortgage throughout their entire retirement. But again, those are some things that are likely to decrease come retirement. As children get through college and start their first jobs and become a little bit more financially independent, that's where another expense that we see decreasing, where there's no longer tuition costs that we might be helping out with. Again, there's not as much financial reliance from children as they continue to get older. And then there's a lot of things that do have senior discounts. So a lot of our retired clients, from a travel or a lifestyle expectation standpoint, there are things that do offer senior discounts, which can lead to a reduction in some expenses. But there's also a number of things that actually increase over time as well. And that's things like travel. Right? I know a lot of savings members, a lot of our clients would like to travel in retirement. And again, that's something that we need to account for as travel may increase over time. Things like entertainment, right? If we look at where the bulk of our spending happens on a weekly or monthly basis, it's probably not during the work week currently, right? Most of the time it's on the weekend as we're doing things that we want to do. Again, making some of those lifestyle choices, right? Doing the things that we enjoy doing. Those things, again, are expected to increase because now come retirement, as the work starts to decrease and we have more time to do the things that we enjoy, those things that we enjoy typically bring an additional cost with them. And again, things that we'll talk about today are things like healthcare and home services, right? Unfortunately, as we get older, those are expected expenses that we do anticipate increasing, and especially with some uncertainty around the future of healthcare and especially long-term care planning, those are potential expenses that we want to address to make sure that our clients have the ability to pay for those needs and continue receiving coverage or continue receiving care to the extent that they may need to. As we look at the expenses in retirement and the time spent doing different things, from 50 to 75, this is where we see a number of different activities and really the hours spent per day doing these different activities. So starting at the bottom and working our way up, sleep doesn't really change very much. All right, we still generally sleep about 8 hours a day. I know some of you might be rolling your eyes and saying, I wish, but again, for most people, sleep is around 8 hours a day. The work you'll see continues to steadily decline over time. So from age 50 until age 75, there are some savings members who take interim positions or might do some subbing or anything like that. But there is some degree of work that may continue. But for, again, most people, that work either completely stops at retirement or may continue to decline a little bit into retirement. Really where we start to see the uptick there is in the socializing, the leisure, and the exercise, right? And with the increased amount of time spent doing that per day, again, that's where there's some additional expenses there as well. So all things that we want to take into consideration: eating, drinking, grooming, home care, household management, as time permits, right? Again, those are some things that increase in time spent doing those activities over time as well. So from today's standpoint, again, looking at Social Security, Medicare, and long-term care planning, there's a number of different facets of details to go into on these different things. We're really going to scratch the surface today just to give a quick overview on things to anticipate and maybe some things to begin planning for with regard to these different areas. From a Social Security standpoint, Social Security is very similar to your teacher's retirement system pension, right? It's based on how long you've been working, the income that you've made over time, and at what age you elect to begin receiving benefits, right? And if you equate that to your teacher's retirement pension, it's based on your years of service, your final average salary, and the age at which you retire. Again, so a couple of different moving parts there, but some similarities between those two income sources. The big thing with Social Security is age 62 is the earliest that somebody can collect. All right, and at age 62, what Social Security actually deems that age is they call it early retirement. Right? And early retirement is any point before what, again, Social Security deems your full retirement age. So for everybody, depending on your year of birth, your full retirement age is going to be somewhere between 66 and 67. All right. So the earliest that somebody can collect is age 62. The full retirement age between age 66 and 67, and the latest that somebody would begin collecting is age 70. All right. After age 70, there's no benefit for continuing to delay it. So Social Security, again, will start at the latest at age 70. For most of our clients, they're somewhere between age 62 and their full retirement age. But once that age 62 is hit, we can start collecting at any point thereafter. So it's not just those 3 points in time. If somebody's 64 when they retire or 65 when they want to start collecting, then they can do that at any point after age 62. All right. But one of the decision-making things that we look at is really making sure that we're maximizing that Social Security benefit over time. Because if we collect early and we collect at age 62, we're taking about a 30% reduction on what our Social Security benefit is. All right. And with that reduction, that's a permanent reduction for the rest of your life. So we want to, again, maximize those future benefits and maximize what you've worked all these years for. So even if someone's going to retire at age 64, that might be the point where we start collecting that Social Security benefit. All right. But that's a very individual conversation. In the case of spouses, it may make sense for one spouse to collect at 62 and another to delay it until full retirement, depending on what the income needs are and the household financial status is. That's where coordinating those benefits between spouses is also another thing that we look at. All right. From a working standpoint, while someone is eligible to start collecting at age 62, it doesn't mean that everybody should. So there's no one size fits all, there's no cookie cutter approach that we can say this works for everybody, regardless of their financial household status. It's the decision to collect Social Security is dependent on a variety of household factors. Again, one of those is continuing to work. So a lot of people don't necessarily know that if they begin collecting Social Security before that full retirement age, there's actually a penalty if they earn too much money. All right. Now with Social Security, as of last year, that penalty was over $17,040 a year. Somebody would have to start giving money back to the Social Security system. All right. So if somebody earned $20,000 while collecting Social Security before their full retirement age, they would have to give back $1 for every $2 they earned over that $17,000 limit. All right. So again, you see the example here. If somebody earned $20,000, their Social Security would actually be reduced by about $1,500. So they would actually be giving money back to the Social Security system, because Social Security would ultimately say that you've earned too much while collecting an early retirement benefit. And because of that, you don't get to keep your full benefit there. All right. Once somebody hits their full retirement age, again, that age between 66 and 67, they're eligible to earn as much as they would like to without any penalty. All right. So again, a few important factors to consider is if there's going to be any part-time or full-time work in retirement, those are some of the things that we want to take a look at before deciding to collect Social Security. For anyone who remembers receiving the Social Security statement every year, probably haven't got that in a few years now. So it's not a big secret, but Social Security is trying to save money. And one way that they are doing that is by not sending out that annual white and green statement every year like they used to. So what Social Security now does is they send those statements out generally for what they call milestone birthdays. And that's usually when they'll start sending those statements out when somebody is 55. and then when somebody is 60, and then once someone's eligible for Social Security benefits at 62, if they don't start collecting right away, they will start getting an annual statement once they are eligible to start collecting. All right, but for anyone under the age of 55, again, you probably haven't seen a statement in a number of years. So what Social Security is now doing is they're making that same exact statement available online. So by visiting the website www.ssa.gov, which is the Social Security Administration.gov website, that same statement is available, so you can put some planning ideas into place to ultimately determine some estimates around what you could expect come 62, come full retirement age, and if you were to delay it all the way until age 70. All right. So again, those are things that we can help with to pull up recent statements, to take a look at what expectations are there, and put some plans in place to see when it may be the most practical to start collecting that Social Security benefit. All right. There are also a number of questions regarding the future of Social Security. And we get a lot of questions from clients asking, well, is Social Security even going to be there when I'm ready to start collecting it? And the way that Social Security is currently structured, it's expected that in the year 2034, if there are no changes from today, that Social Security will still be around, but they're not going to be able to pay the same benefits that we're expected to receive today. So come 2034, Social Security is expected to only be able to pay about 80% of the benefits to the people collecting Social Security. So that's where we could look today and say, well, my expectation is that I'm going to receive $2,000 a month at a future point. Social Security, if there's no changes, could just start sending checks for $1,600 in that case, because they're not able to pay the full benefit anymore. So again, those are some planning opportunities to make sure that whatever the future of Social Security is, that there's plans in place to help supplement what pensions, what Social Security is ultimately going to provide. And if there are changes to that effect, then we have some things in place to mitigate some of the potential decreases in that Social Security income. Stepping into Medicare. So there are a lot of assumptions, there's a lot of uncertainty around Medicare and how that actually coincides with health insurance and retirement. So ultimately what Medicare is it's a health insurance program for retirees. And we're at age 65, everybody is eligible for Medicare. They're ultimately required to enroll in Medicare if you're not covered by an employer's plan. All right, so Medicare does have a few parts to it, parts A, B, C, and D, but there's, again, some uncertainty and some unclarity around what those parts actually provide. So Part A for Medicare is really for hospital coverage, all right, and that's inpatient hospital care, that's skilled nursing facilities. It's a degree of home health care, hospice care, or inpatient psychiatric care. So to qualify for Medicare, someone has to be 65 years old, they have to have paid into the Social Security system for 10 years, and they have to be a citizen or a permanent resident of the US. So with providing that Part A coverage, this is where a lot of people approaching retirement think that Medicare is their free insurance in retirement. That's only partially true. Medicare Part A is the free coverage, but it really only provides for hospital care. So that's where there's a few things there, again, to be aware of in leading up to those retirement years. Now, with SANES members and New York State employees, it's very unique because there are some school districts that do provide health insurance coverage into or through retirement. And depending on the district, it might be provided for a SANES member and their spouse, or maybe just a SANES member, where then a spouse has to still get Medicare coverage once they're eligible. So again, a few things that are determined by contracts and by specific districts and administrators groups, but again, some things to be aware of and to start putting plans in place as retirement approaches. So what's unclear a lot of times with Medicare is that the Medicare is thought of as the free insurance, but there's a lot of things that Medicare doesn't actually provide. So that's where some of the other parts of Medicare come in, right? So Medicare, the free coverage is really the Part A. Parts B, C, and D are optional plans for someone who doesn't have any supplemental coverage. So for someone who needs coverage for doctor's visits, for surgeries, diagnostic exams, or wants coverage for potential emergency room visits, that's where Medicare Part B comes into play. That's also where, as you can probably imagine, there are additional premiums and deductibles and co-insurance costs in order to have that Part B supplemental coverage. All right. So sometimes, again, the district health benefits, the retirement health benefits, will cover some of these supplemental needs, but a lot of times, once someone retires, they may need to get these supplemental plans for themselves and/or their spouses. So with Medicare Part A hospital costs, all right, this is also where there are some unknown expenses that come into the picture. All right, so even if somebody is covered by their Medicare Part A and they need to visit a hospital, the first 60 days, they're actually responsible for a $1,340 deductible. All right. If somebody stays longer than 60 days, so between 60 and 90 days, there's a co-insurance rate of $335 per day for each benefit period. All right, and what those benefit periods mean is if somebody were to be Medicare eligible and they were to need to go to the hospital in January and they stayed for 60 days, and then they went in July again, that's a different benefit period. All right, so ultimately there are some out-of-pocket expenses even with that free insurance that premiums don't necessarily need to be paid for. Beyond 90 days, if someone were to stay in a hospital for beyond 90 days, they would also be responsible for $670 for each what's referred to as a lifetime reserve day. So everybody has 60 lifetime reserve days that they can use at any rate, but it's only a one-time use. So after those 60 days are used up, someone would be responsible for all of the costs associated with that hospital stay. All right, again, not things that are necessarily known a lot of times when we think of Medicare and we think of healthcare and retirement, but things to, again, be aware of. There's also the Part A skilled nursing costs, which there are supplemental costs to those benefits as well. Depending on the level of care, the length of stay, and how much care somebody needs, again, there are out-of-pocket expenses that are required in order to fulfill any skilled nursing costs there. Just to give everybody an idea, the Medicare Part B costs, so those again are for things like doctor's visits and diagnostic exams and things like that. The cost for those Medicare Part B premiums is completely income dependent. So based on where somebody's income is, that's what determines the premium that they would pay each month to have that supplemental coverage there. So won't go through this line by line right now, but again, just to be aware that there are out-of-pocket expenses, there are additional premium payments that you may have to include in that planning process to make sure that any of these health insurance needs that you have over time in retirement are taken care of. And again, this may be for you and or a significant other or a spouse. The third thing that we're going to talk about today is the long-term care piece. And long-term care is ultimately needed when someone cannot perform the activities of daily living. There's 6 activities of daily living, things including eating, dressing, bathing, maintaining general cognizance, again, that's mental wherewithal, and then toileting and transferring. So if someone's unable to perform some of those activities of daily living, that's where somebody may need to find assistance, either in their own home, an assisted living facility, or a nursing home, to help make sure that someone can still maintain a certain standard of living. All right. So the cost for potential long-term care, the average cost for a semi-private room is a little bit over $7,000 per month. All right. And that's something that, as you can see here, is fairly expensive and can really drain a personal savings account, can put a family in distress, can potentially have an impact on homes and real estate and investment assets and things like that. So the planning around long-term care, we hope that we never need it, but there's a likelihood that we all will at some point. So there's a lot of statistics out there, and not to raise concern or cause alarm, but again, this is really where, from a planning standpoint, we can make sure that anything that can be avoided from a financial standpoint or a detrimental financial standpoint, that there's planning that's taking place in front of this, so that when that time comes, or if that time comes, that it's not a financial ruin or doesn't cause financial devastation to a household or a couple. So there's, again, stats out there that say about 70% of seniors will need some sort of long-term care service or support because of a physical or cognitive impairment. The average length of time is generally about 2.5 to 3 years of needing that service. And again, there's certain planning techniques, whether it's on the financial side, whether it's on the insurance side. There's estate planning techniques to help mitigate some of those potential costs down the road and preserve assets. There's a number of planning opportunities around that, but again, the earlier we look at that, the more options there are. When we look at the probability of needing some sort of long-term care service, again, these different statistics here provide a general overview of the percentage of people who may need them and to what degree. So from an assisted living standpoint, about 13% of people need assisted living at some point, 38% need nursing facilities. The overwhelming majority of individuals try to stay in their home as comfortably as they can and pay for care on an individual basis. So again, those are different options there, but without proper planning, it does become more difficult to do that. All right. So from an overall standpoint, I know we ran through this very, very quickly, but from an overall standpoint, we know that retirement is changing. And with all of the uncertainty out there around some of these different facets of the retirement planning phase, we know that proper planning and proper consideration for these different topics can lead to additional financial stability down the road. Understanding how Social Security, Medicare, and potential long-term care needs are going to impact or potentially affect the future livelihood of your retirement, those are all the things that, again, we help our clients uncover, right? Making sure that these things are addressed, making sure that there's awareness around these different topics are all things that we want to assist with. From the financial planning side, that's where we work with our Sanies members. We don't ever charge a fee to sit down with us. There's never an hourly charge to review pension estimates, to review Social Security expectations, but ultimately it's our job to tie all these different income sources together, looking at how pensions and Social Security and retirement assets and real estate and primary residences, how all these different things are really working together to help come back into that retirement household in a cohesive, comprehensive way, right? There's a lot of things that we have to look at to make sure that all of these different segments of the retirement income are really working in conjunction with one another. We don't want something out there that's working completely against the way that everything else in that financial household is working. So again, there's just a lot of continuity that has to happen between these different retirement income sources. Just to give everybody an idea here are some resources to help explore these things a little bit more. Again, if anybody needs any help or any assistance with visiting these sites or looking at specific examples of of what they're eligible for, what they're entitled for, how their district benefits are going to coincide with some of these moving parts down the road. That's what we are ultimately here for through our partnership and for our savings members. I'll close with this. So I am local here to the Capital Region and the Poughkeepsie offices. We do have other financial partners in all of our other regions across New York. So whether it's Long Island, whether it's Syracuse, Rochester, Buffalo, down into the Vestal area, anything like that, we are across New York. We are all over the place. So if it is a local personal conversation that you'd like to have, I'll leave this up, but this is the contact information for all of our AXA colleagues across upstate and downstate New York. So with that, I will open it up for any questions. And I will say that I know there's a lot of individuality to these different conversations and to these discussions. So I'll try to answer any broad-based questions, but if for anything specific, I might reference this again to put you in contact with your local representative.
Thanks a lot, Greg. We do have one question, and I will read it to the group now. Here's the question. I'm 56 and potentially retiring due to the elimination of my job. I will get some payouts for vacation and sick time that must go into a non-contributory retirement account. Since I can't collect Social Security yet, how should I consider positioning/utilizing the payouts to help cover living costs? I will have medical coverage through my current employer.
So that's a good question, and we unfortunately are seeing that in a lot of different school districts and state agencies. So there are ways to take that non-elective contribution from the district as a sick pay or vacation day buyout. And once the separation of service happens, if it's set up correctly, there's generally access to the funds that the district is contributing for you. All right, so even being 56 years old, you have the ability to open a 403B, which most districts actually require those payouts to be deposited into. And once that 403B is open and a separation of service happens, there are different ways to access funds in that 403B to offset lifestyle expenses and income needs and things like that. So again, depending on where you're located, that's where we have a number of AXA advisors like myself that can assist with a couple of those, either opening the 403B, but also assist with talking about distribution strategies and figuring out what income needs might need to be met from that.
Okay, great. Yeah, that's all the questions that we have. If anyone else has any other questions, please feel free to go to the SANES website and you can contact your local AXA rep with any other questions. Thanks so much, Greg, and have a great weekend, everybody.
Thank you very much.